and good afternoon, everyone. Thank you for joining us. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Robert J. Havey, MD, Institute for Global Health, and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions and addresses the latest COVID headlines every Tuesday and Thursday here on the Havey Institute for Global Health's Facebook page. And today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest headlines through today, the 26th of October. And we invite you to continue to submit your questions to us via Facebook at NU Institute for Global Health or via email at globalhealthinstitute@northwestern.edu. And leading the discussion again today is the Student Research Assistant with the Institute, Sophie Buskowski. And Sophie, I now turn it over to you.
Thank you, Kristen. Hi, Dr. Murphy.
Good morning.
So for some updated statistics, in the United States, 57.7% of the population is fully vaccinated. There is now a 7-day average of 72,000 positive cases per day, which is under 75,000 daily average positives. There's also been a 25% decline in cases over the last 14 days, and hospitalizations have gone down 19% and deaths have gone down 13%. Colorado is seeing a minor increase along with other states such as Maine, New Hampshire, Arizona, Vermont, and Connecticut, but overall, the majority of the states within the United States are going down. And in Illinois, we are now seeing 54.4% of the population fully vaccinated, and there has been a steady decline of 22% over the last 14 days with positive cases. What can you tell us about some of these statistics, being that only a select few states are seeing a small spike in cases?
Well, I mean, overall, the number is looking very good. We're coming down, but there's still 75,000 cases per day is like way too much. I mean, we're just getting numb with these numbers. This is not a good number, but it's going in the right direction, so that's good. And also, it's just so strange that you've got states, Connecticut, Vermont, Maine, Colorado, who are having increases in the number of cases. So, you know, there's regions that are behaving very differently. And so we can't let our guard down, and we have to keep pushing with the mitigations where there's a lot of cases and keep pushing the vaccines. It's the only way to bring this thing completely down and under control.
Yes, absolutely. And speaking of keeping things under control, for this week, we're going to talk a bit about the holidays. We have Thanksgiving coming up in about a month. Can you tell us about some tips for traveling, some tips for being in homes, vaccinated or unvaccinated, with or without masks? What can you tell us about the holidays?
Yeah, no, it's a very problematic right now with the travel. I got travel questions like every day, multiple questions. For unvaccinated people, I mean, they shouldn't be traveling because they're putting other people at risk. For everybody else who is vaccinated, since you still are at risk, although the risk is much lower, you should try to limit your travel to places that don't have much COVID or into family households where everybody is vaccinated. If you're mingling with vaccinated and unvaccinated, that's that's high risk. And if you have, especially if you have any underlying medical conditions, this could be very dangerous for you. So it's just really, I mean, if you absolutely have to travel, you travel, you make sure you're vaccinated, you make sure you're boosted, you make sure you wear your mask when you go in public, and stay 3 to 6 feet away from everybody. You know, try to be as safe as you can if you have to go. If you don't have to go, you shouldn't go.
Correct, absolutely. And for the biggest headline of the week, which is very exciting, the FDA is meeting today to get the Pfizer vaccine approved for ages 5 to 11. What can you tell us about what this might look like for the future for children?
Yeah, well, they're meeting today. They're meeting right now as we're speaking. And it's very likely that they will approve that. Moderna is very close behind. They also had a headline today that says their vaccine works in kids as well. That hasn't been formally reviewed by the FDA or CDC yet. But the Pfizer is likely to get approved. It's a very low dose. It's 10 microgram dose versus 30 for adults. And it looks like it's safe in kids. And that's going to be a very large chunk of the population that will be eligible for vaccination and can then help keep our schools safe and to get the pandemic under control.
Yeah, absolutely. So for some questions of the week, we have this individual who is severely immunocompromised and would like to understand whether the vaccine is protecting them from being severely immunocompromised, or should they be receiving regular courses of monocle antibiotics? And should they wait until the pandemic is endemic? Or
So people at risk for disease progression are different than people that are severely immunocompromised. That latter term really is somebody with an underlying hematologic malignancy, a cancer that's affecting the immune system, or the treatment for the cancer is suppressing the immune system significantly. It also includes organ transplant patients, people on high dose steroids for whatever reason. So those people do not respond to the vaccines very well. They respond, but it's poor. And in August of this year, they were approved. Emergency use authorization was given to them to get a third shot. So it's actually technically not considered a booster. They just need another vaccine. Preferably when they're off their immunosuppressive agents. Usually those are given in cycles, but it doesn't really make any difference. I mean, they should just get that anyway. Now, if you do get that third shot, a significant number of those people do respond to the vaccine. So that's why the EUA was approved by the FDA in August. Now, as far as giving monoclonal antibodies, it already is approved in the United States that immunocompromised patients who are exposed to somebody with COVID should go get the monoclonal antibody. They can get that. The pre-exposure prophylaxis, in other words, you're not exposed to anybody, but you're at risk. That's another area that's being studied right now. In the United Kingdom, they have done a study called Provent, was reported recently. They have a monoclonal antibody that AstraZeneca has made. And in over 5,000 patients who were given this high-risk patients, given a shot of this. Now this is given, their vaccine is given intramuscular, not given intravenously. So it's a little bit easier to give an intramuscular. It's like getting a flu shot, but it's bigger. They got the antibodies actually from that shot lasts for up to a year. Wow. So they are looking at that for pre-exposure prophylaxis. It's not approved yet. The study is ongoing. The preliminary results look very encouraging, but they're continuing the study. And I think we'll see pre-exposure prophylaxis for these really high-risk people will become a reality at some particular point. And the nice thing about this AstraZeneca product is that the intramuscular administration, it lasts for up to a year. So that you only have to have one shot a year. That would be really great. The intravenous ones that we have here in the United States work for several months, maybe up to 3 months or so. That's good too. But I mean, imagine just getting a shot and you don't have to worry about it, getting COVID for a year. That's really good.
Yeah, absolutely. And for our second question, recently, my 68-year-old vaccinated husband was sick with fever, chills, etc. His rapid COVID test taken the day after his symptoms started was positive, while a PCR test taken the same day was negative. Another PCR test done 4 days later was also negative. What can you tell us about false positive that you're seeing in the rapid COVID test?
Yeah, the rapid tests are good, but they're not great. The PCR tests are much better. So it's two different things. The problem with the PCR test, it takes so long to get the results. And if you go to a commercial lab, it's going to take 1 or 2 days, even 3 days to get the results. I mean, that kind of negates the whole, urgency of the situation. The rapid test, you get your results in 15 minutes. It's terrific. And they've said that, you do a couple of those tests after you're exposed. If you do 2 or 3 of those tests and they're all negative, that's as good as a PCR test. So there's a lot of places where the rapid tests come in really handy. Now, one of the issues with them is that they're not as specific. Specific means the test is positive, but you're really negative. And that's what's happening in this case here. Now, whatever that person has is triggering the test result. And that's just life. That's why you do the confirmatory test if you're not sure. One possibility is that this 68-year-old gentleman may have a regular cold-like coronavirus infection, one of the non-SARS-CoV-2 coronaviruses. There's a whole family of them there. There's a group that 4 of them that can cause like common cold. Maybe he has that, and that antibody cross-reacted. It's just a supposition. I don't know if that's the case or not. But whatever it is, this person triggered a false positive, and that's just the way it goes. It doesn't mean the tests are useless, but that is one of their limitations.
Yeah, absolutely. And for this individual, their mother lives abroad in a country where she got Sputnik, and she's been fully vaccinated since early August. With the US mandate of tours only allowed if fully vaccinated with vaccines recognized by the WHO, she will need to get another dose of either Moderna, Pfizer, or J&J in order to come for the holidays. What is your recommendation for Sputnik in combining a different dose? And should it be a concern that this individual got the second dose 3 months ago?
Yeah, Sputnik, Sinovac, the other Chinese vaccine, these are made in the kind of older style of vaccines. They're not as good as the mRNA vaccine, or not as good even as the J&J or AstraZeneca vaccine. So, they're just not that great a vaccine. And that's why they're not considered safe to come into the United States. The WHO hasn't approved it either. What this person can do is really take any of the approved vaccines. It doesn't matter that it was just 3 months ago. It's not going to hurt you because that vaccine actually is kind of so weak anyway. Go ahead and take any one of those that you can get, even the Johnson & Johnson single dose. This person is, over 50 years of age. And so that risk of blood clots with the J&J vaccine is much, much, much less if you're over 50. It's occurring mostly in women under 50. So, any of those vaccines they should take.
Yeah, absolutely.
Mm-hmm.
And lastly, in terms of a booster, this individual is 60 years old and overweight, their wife as well. And they were not able to get the booster. In fact, they were turned away, even having their second dose exactly 6 months ago. Can this individual get the booster when they're overweight, and should they get the booster?
Yeah, so obesity is a risk factor. And so I don't know why this person was turned away. I think where they were turned away, I think whoever did that made a mistake. And I think you should just find another place to go and just go there. I mean, every pharmacy out there is giving these shots these days. Just go try a different place. And the other thing I would do is I would complain to your Department of Health. If you're in the city of Chicago, you complain to the Department of Health of the city. If you're outside of Chicago, you complain to the state of Illinois Department of Health and say that you were refused a vaccine, and name the place and the date. If you have a name, that's great too. But if the name, the place, and the date is good enough, and you should complain, because this is not supposed to happen.
Yeah, absolutely. Well, thank you, Dr. Murphy. That's it for today.
Oh, one thing, we do have a study that if anybody is exposed to somebody and wants to get tested with both kinds of tests, the PCR and the rapid test, we are happy to do that study with them. There's no charge, of course, and it's a very simple procedure, and you get all the tests basically with, of course, no charge. There's no charge at all, and you could find out if you're really infected or not.
Yeah, and if you're interested in the study, the email for the study is covid19tests@home@northwestern.edu.
Great.
Thank you, Dr. Murphy.
All right. Thank you, Sophie.